Happy Tuesday, everyone, and welcome to the interactive Zoom platform experience where we discuss all things photobiomodulation and Lifewave. Guys, it is always a pleasure and an honor to speak to you. My name is Dr. Jeffrey Hubbard. I'm your host and facilitator. I am a medical doctor who is very enthusiastic about finding awesome wellness products and wellness strategies to help people to achieve optimal health and to prevent the development of disease. As always, here on the platform, this is a wonderful opportunity for us to learn and become properly familiarized with this amazing technology and the awesome science of photobiomodulation. Ladies and gentlemen, that is just a fancy scientific term for light therapy, all right? Here is the example of one of the patches from Lifewave. As you can see there, behind the peel of the paper, there is fiber mesh. That fiber mesh is covered with a proprietary blend of organic materials. You can think of them like a liquid nanocrystal. They are designed specifically to reflect certain frequencies of the near infrared light spectrum back into the skin. This area of the light spectrum has been studied, and there is really powerful evidence that shows that when you are exposed to this particular frequency of light, it helps the body to do certain things. In the instance of the X39, or this patch right here, that phenomenon helps to raise a molecule called GHK copper peptide. And this molecule has been studied since the early 1970s by a gentleman named Dr. Lauren Picard. He's a Harvard professor and world-renowned researcher. He has been able to show that this particular molecule engages our DNA, and it helps to express certain genes, 4,192 of them to be exact. And the expression of these genes is altered in order to bring our body into a very powerful state of healing and prevention of certain problematic issues that arise, all right? So what happens? I mean, when you're consistently wearing the device, many things happen, but what most oftentimes happens is people feel a very profound level of restfulness when they get to sleep and stay asleep and wake up and feeling refreshed and ready to go for the next day. Energetic, very clear and focused mind, cognitive improvements, cardiovascular improvements, endocrine improvements, and the list goes on and on and on. The reality is, guys, it just makes you feel younger and more vibrant, and the proof is in the pudding. I recommend that everybody should wear the X39, at least to understand how it's going to make you feel, and you can make your own determination for yourself. I was impressed. Approximately 80% of individuals who wear the patch feel some significant difference or noticeable difference within the first several days to a week. But oftentimes, the real magic happens far into the utilization of the patch. So we recommend that you wear the patch a minimum of 90 to 120 days in order to really appreciate some noticeable changes or improvements in whatever the case may be that you're looking to address. One of the most powerful things, many of our Lifewave family are seniors, and they've got aches and pains and joint issues and things that have just developed from normal wear and tear over the course of their life, and they are falling in love with the X39 because of its ability to make those joints feel younger and to perform better and to have less inflammation, less pain, etc. So very excited to discuss how to properly utilize the patches. They are placed at acupuncture locations, and those acupuncture locations are very, very valuable because they can stimulate certain things. They can stimulate a full body experience. And so there's 12 different patches. 11 of those are for humans, and they can be worn in any combination. And most oftentimes they're worn for 12 hours, and then you rest for 12 hours. So the body has a very similar sort of relationship with this type of light therapy as you do with the sun. So, approximately the sun is up for 12 hours during the day, and then there is an appropriate equivalent of nighttime. So it's the same thing for the body. When you're experiencing the light therapy, you have to go through a nighttime component as well. But the beautiful part about these patches is that they can be worn in various different sequences. So each one has its own unique frequency. So as long as you don't wear the same patch for more than 24 hours, you're in good shape. So you can wear certain patches during the day and certain patches at night. So there's a lot to appreciate about the patches and how they work. All right. So that's the intro, guys. We're going to jump in. As you heard last week, we're going to be doing a series of anatomical evaluations and kind of helping to understand what's going on underneath the skin in certain areas, and what are some of the common ways that damage occurs to those areas, and what we can do patch-wise to be able to help and improve any sort of decline or issue symptoms in those various different areas. All right, so last week we did the knee. This week we're going to look at the shoulder. All right. The shoulder is one of our most fragile joints, and we oftentimes talk about it in the clinical world as a beach ball on a plate. All right. So it's very difficult to support a beach ball on a plate. The humerus, or the top portion of the arm. So let's just do that. Let's go over some brief anatomy just so we're kind of clear on what components make up the shoulder. All right, so you have the humerus bone, all right, which plugs into the scapula. All right, the scapula is your big wing bone there on the backside of either shoulder. All right, so there is a cuff that the humerus head attaches to right here, and then there is the clavicle or the collarbone, and it attaches as the third bone to support the shoulder. So one of the major joints that you have to consider is called the Homeoclavicular Joint. All right, so that's the clavicle and the acromion portion of the scapula that leans over. So if you've ever heard of anybody having a separated shoulder, that is when that particular joint is damaged and there's more space that should be between the bone of the humerus and the actual joint and socket where it connects to. So there are a whole host of various different tendons and ligaments that make up the shoulder. And we won't go into extreme detail. I won't bore you with all the names, but essentially the whole objective of all of those various different soft tissue connections is to keep this humerus head connected to the socket and to make sure that the shoulder does not come out of position or does not come out of place. All right. Another key area that is oftentimes challenged or becomes diseased over time if you're not careful is the rotator cuff. And so the rotator cuff is responsible for internal rotation, right? As well as external rotation. So there's three major muscles that attach from the back around to the front of the shoulder that helps to turn your arm either direction. That is the infraspinatus muscle, the supraspinatus muscle, teres minor. All right. So all three of those are attaching in order to do external rotation. All right. Then you've got teres major and a few others that are responsible for internal rotation. All right. So oftentimes, as the scenario with me playing baseball or using something with repetitive motion, you can also see this with tennis. You can see this with bowling. you can see this with some cross, that there becomes this inflammatory process that happens in the shoulder, and it makes your rotator cuff sore and prevents you from being able to do certain motions. All right. So also within here, there is a Bursa Sac, very similar to what happens in the knee. This is your shock absorber. It's what helps to keep the joint lubricated and all of that good stuff. That can become infected, that can become damaged. There's a lot of different scenarios that happen with the internal capsule of the shoulder and require all sorts of treatment and therapy and good stuff. So the benefit of the patches is that you can do some very intense some inflammatory adjustment process with the patches to be able to reduce inflammation of the shoulder. X39 has been really powerful in helping to rebuild soft tissue and damage weak sort of tendons and ligaments to keep the shoulder strong and in place, and allow for those certain motions that become challenged if those particular elements of the anatomy are not functioning properly. Right? You can patches directly here on the shoulder joint. So this is a very common place for injury and issue. Also you can place them on the back of the shoulder. This muscle right here is the deltoid, so it has 3 particular areas of the muscle, and they're responsible for raising the arm in various different motions when the arm is extended. And so patching those muscles could be very helpful. And you could even come up here, as we talked about a couple of weeks ago, into the trapezius muscle, deep into the shoulder, and begin to impact the way that those nerves flow down from the neck into the shoulder. So those are a couple of helpful places right here. This is gallbladder 21. And then there's tons of various different locations here. So it's probably easier to put the patch directly on the area that is most painful or is otherwise inflamed or swollen. All right. So we're doing pretty good on time. I thought we were going to be crunched. We got through the anatomy of the shoulder. If there's anybody on who has any questions about the shoulder, please raise your hand so we can jump to those questions immediately. You can use the reaction icon, which is in the lower right-hand portion of the screen. It's a smiley face with a plus sign. If you click that, there's a host of emojis you can use. One of them is the ability to raise your hand. That would be my suggestion, is to raise your hand so that I can find you and give you the floor to be able to ask your question, right? So before we jump into Q&A, just a little housekeeping. These patches, as awesome and dynamic as they have not been approved as a type 2 medical device. That simply means that the Food and Drug Administration does not consider these products capable of addressing any medical condition, heal, treat, cure, prevent, any of those sorts of things. So we don't use them here on Ask Dr. Jeff. We just use Lifewave language. We talk about the symptoms and the issues that we're having and what we experienced before we used the patches and what we did or what we experienced after the patches. Or we describe what's going on and we talk about it until we both understand what it is that you're trying to accomplish, and I can then make a suggestion. All right. So Amiko is up first. You can go ahead and unmute yourself and ask your question. Thank you very much for joining today.
Hi, Dr. Jeff. Thank you for taking my question. I have a friend who is suffering from severe high sugar in the blood.
Okay.
What would you suggest and where?
So 3 patches come to mind when dealing with high blood sugar levels or the inability to metabolize your sugar. Number 1 is X39. Reason being is because in many instances, there are underlying causes that are just stress, diet, and nutritional deficiencies, et cetera, that are contributing to the shifts in physiology that lead to being unable to process your sugar appropriately. Okay, so that X39 begins to kind of work behind the scenes to address a lot of those things. Carnosine is a really great choice as well. Carnosine has a couple of benefits. One, it is really dynamic at reducing lactic acid, and lactic acid is something that happens because you're not able to appropriately metabolize your blood sugar. Also, it helps to glycosylate certain sugar types. And so it does help to break down those sugars in the bloodstream as it's active and is doing its thing. It also helps with inflammatory processes in the peripheral nerves. And that can be really dynamic as well to kind of help deal with some of the problems and symptoms associated with being unable to metabolize your blood sugar. And finally, is a great choice. Glutathione has been proven to improve insulin resistance. So your pancreas is secreting this insulin hormone, and it's going around to all of insulin receptors. And this is a complex process because insulin is how that glucose gets inside the cell. So if the insulin and its receptor are not binding properly and not doing what they're supposed to, and glucose can't move from the bloodstream inside the cell where it's supposed to be, then that's the definition of having elevated blood sugar. So glutathione does an excellent job of helping to reduce insulin resistance, and it also helps with peripheral circulation, and it's a wonderful antioxidant to help clean out the cells and help to remove toxins and heavy metals from the system. So it is a really great addition to that trio. And I think that's the way I would approach having abnormal blood sugar. And if it's really severe and there's some additional things that need to happen, lifestyle modification, and you need to hydration status, mineralization. There's a lot of science that says that chromium and vanadium are really great for addressing challenges with blood sugar metabolism as well.
Great, thank you.
All right, ma'am. Did that answer your question?
Would you just put them on the normal places that they suggest for those patches?
Yes. So I think for the glutathione, I will put it on top of the right foot.
Okay.
That is one of the locations that's commonly used from the booklet. It's liver 3. And then for X39, because the issue is in the abdomen, I probably would place it on conception vessel 4, which is the one that's below the navel. So that is a very common place as well. And then carnosine, I would put it on the center of the chest. That is conception vessel 17, and it's on the sternum right at the nipple line.
Okay, great. Thank you.
All right, ma'am. Thank you very much. All right, so I did see a second hand. All right, go ahead, Mr. Garcia. Go right ahead.
Yeah, Doc. During my X-ray just recently, there is a notation on the X-ray said lumbar spondylosis. But when I had to consult the ortho, he said it's due to aging. So, but before I went to him, I am using now X39 here and below the navel X49. Will it be dealt? That will be enough?
I think so. So the thing is, Mr. Appreciate is that, as I mentioned in the introduction, you need to give your body time to adjust. And that's really important, is your body needs to have time to adjust to the light therapy. So if you haven't been using the patches for 3 or 4 months now, I would not expect to see much change in your X-ray. There all the patches have benefits, but I think specifically for the soft tissue injury that you're having in your spine, I think it would be really easy for X39 to begin to make those adjustments. So I think you're in the right position. I don't think you need to add anything, but yes, if you did add something, it may possibly benefit you more.
Okay, so what specifically, because I use it during daytime, let's say 8 o'clock in the morning to 8 o'clock p.m., that's 12 hours, X39 and X49. So at night time, do you suggest to use some form like the YH or something?
Yes, that would be what I would suggest, but I actually would wear X39 and 49 at night for you, because that would likely be the best time while your body is rebuilding and healing for you to wear that. So I would wear that in the evening, and then, you know, glutathione should be very helpful for you, as well as carnitine would be very helpful for you during the day. That's just a great patch in general. So I would try those. You know, Eon is something I wear personally. I wear Eon at night. So if you are wanting to add Eon to your regimen, I would put that on at night with the other patches that you have.
Okay, thanks for that. So it means I had to switch now because I used, the reason why I asked, because when I used already about 4 days to start the X39 49, I feel sleepy during the day, but I feel it's relaxing, but I agree I should switch at night to have a good, and during daytime I have to use glutathione and carnosine, right?
Yes. So like,
So
for
the
instance,
placement of glutathione and carnosine should be where for the daytime?
I would use the regular locations. You can put glutathione on the top of the right foot, and carnosine is probably best for you underneath the navel. So
underneath the navel.
Yes, under the belly button. Yes.
Okay. So 2 fingers below the navel, the carnosine, and
the
right foot will be glutathione. 4 fingers.
Yeah, like
okay.
4 fingers, and then glutathione is on the top of the right foot, between the first and second
right foot, in between
correct.
the toe and the next.
Correct.
Okay, thank you, sir. Thank you, Doc. And the Aeon at night, because I have X39 here and X49 below the belly button. Here. So
on your third. Yes.
So, yeah, because I have this intermittent knee pain on the right
okay.
knee. When I bend, it will nothing to put, or I put Icewave on the knee.
You can put Eon on the knee, you can put Icewave on the knee, or you can put on there. And subscribe to my YouTube channel. Just go onto my YouTube, you can find it by Jeffrey Hubbard, MD, or you can look for Ask Dr. Jeff, and you'll see all of the old videos. There's 80 videos to look at. We talked about the knee protocol.
Yes, that's good to know. Because I missed your previous one, because this is the first time I attend this one. So I should locate. Yeah. So okay. Thank you very much. Yeah. Thank you very much, Doc. Well, there's some question from my friends, but I will give the floor to other first. I'll just type their question, because some friends, my enrollees are asking me. I said, let's give the floor to other first. And I'll just type the question of my friends here in Iloilo. Yeah.
Okay.
Thank you.
So I'm going to put something in the chat, because we're going to have to shut down today, because I'm going to be on another Zoom. So it's livezoom.com. I'm putting it in the chat. So everybody, this is my Tuesday to join Greg and Robin Mascari on their doctor Zoom call. It happens every Tuesday. This is my Tuesday of the month. So if you'd like to continue to discuss and understand what's going on with Lifewave, you can transition over to that call. I need to be there for 8 o'clock. So I've got just a few moments to conclude with you guys before we transition.
Okay. Yeah.
You'll be able to ask questions there as well. And we'll have a lot of discussion. I'm sure you'll find it very edifying if you take the time to join us over there. And it's about an hour-long program from 8 Central to 9 Central. All right. So
Okay. Yeah.
for those of you who sent me emails and added yourself to my database, you will be receiving emails tonight, tomorrow, and rolling into the beginning of the month about all of our new services through Ask Dr. Jeff. I am offering services to you guys first. You guys are my close-knit Lifewave family. And before I share this with other Lifewavers, I want to provide the opportunity for you guys to become subscribers to the new services and all of that stuff. So I will be sending you an email with details and all of that good stuff in the coming days. So stay tuned for that. If you have not given me your contact information and you'd like information and you'd like to be added to the database, you can just send me an email at contactdrjeff@gmail. All right, contactdrjeff@gmail.com, and I will add you to the database and will provide relevant information where it is fit. All right. Guys, as always, it is so wonderful to share space. Please go to the YouTube channel, like, subscribe, ask questions on the videos. I'll respond to you there so that it's public and we can continue the discourse in that way. If you have some questions, things that please shoot me an email at drjbhubbard@gmail. Okay, so that's Dr. JB Hubbard, MD @gmail. All right. Thank you so much for your time. As always, it is wonderful to share space. Please, guys, go over and check out Greg and Robert Mascari's Zoom. I'll be there in just a few moments. All right. See you next time, same channel. See you later.